Welcome to SGT University. Friends, the entire world is suffering through this global pandemic, Covid-19. And we keep talking about the physical ailments. But what about the mental stress, the depression and the anxiety, which every age group is facing in this pandemic? Whether it's the kids who have to be on their online classes the whole day, the middle-aged who have to worry about earning for the family and at the same time not infecting their kids and their parents, and obviously the aged and the elderly who are home but always in a fear for their children and for the infection. This entire scene creates a depression and anxiety in the minds of everybody. So let's not ignore our mental health. Today we have an expert of mental health, a psychiatrist, Dr. Ved Mehla, Professor and Head, Department of Psychiatry, Faculty of Medical and Health Sciences, SGT University. Welcome to you, sir.
Hello. Welcome to everyone. And Madam will be asking questions regarding mental health, positive mental health, stress during pandemic COVID-19, and how to cope up with it. So I invite her to ask me questions, and I'll be very glad to answer in the best possible manner, which can be understood by the students, the faculty, and even the lay public.
Thank you, sir. So, sir, let me begin by asking, how do we actually cope up mentally with the pandemic COVID-19?
Yes, I think this is a very relevant question. First, we have to understand that what is mental health? How do we define mental health? In fact, mental health is a state of emotional, psychological, social, and cognitive well-being. How do we behave, act in health and diseases depends on how well we mentally are. Because mental health determines how we react to other people, how we cope up with stress, and what choices do we make during the time of crisis. So mental health is an absolutely important aspect. Say I give an example. For example, somebody who's mentally healthy will make a right choice if he finds somebody suffering from COVID-19 in his family or he himself suffers from COVID-19. He will try to find out the resources. He will try to go on Google and search where the resources are available. He will give a telephone to somebody who can help him or find friends who can help him. So the making of a choice depends on one's state of mind. And in that context, I think mental health is an extremely important aspect.
We all keep talking about mental health, and we've often heard the term positive mental health. So what is this positive mental health?
Yes. There are three things. One is mental health, one is positive mental health, and then there are mental illnesses or diseases or disorders. It's very important to differentiate between mental health and positive mental health. Positive mental health makes a person realize one's potential. It makes one to communicate with others productively. It helps one to function optimally. And it helps one to contribute to the community in which one is living. If somebody can do all of these things, that means that that person is having positive mental health. Just having mental health, a person may just be living and just surviving and going through his life, maybe without much conflict within or outside, but that's not positive mental health. Positive mental health essentially means actualizing one's potential and contributing to the community in which he is living and working productively and functioning optimally at whatever he is doing.
So what are the various steps that one should take to cope up with the stress of this global pandemic COVID-19?
I think this is a brilliant question. I think everybody must be asking, what do we do to cope up with the stress of COVID-19? which we are all exposed to. I think everybody of us is worried about ourselves, of contracting it and then recovering from it and then going back to the society. So there are many issues which crop up, and we worry about our elderly family members who stay at home while we are working as doctors, say for example at hospital. So we are worried that when we go back we might not infect them. So I will enumerate from 1 to n number the various steps which can be taken to cope up with the stress which has been caused by the pandemic. The number 1 step is that you must be aware about the resources which are available for dealing with the COVID-19. Say for example, what helpline to call when somebody falls ill or somebody is suspecting that he is not feeling well, which helpline to call, which are the resources and which are the doctors and hospitals available where one can go if somebody or his family member suffers from COVID-19. This is one foremost important thing. Other thing is that the person should be emotionally well, because unless somebody is emotionally well, he cannot or she cannot make a good choice about what to do when somebody falls ill or when is facing the crisis of pandemic. So feeling emotionally well, we can take certain steps, and most important step is that seek professional help. In times of crisis, seek professional help. There should not be any shame or taboo about seeking professional help. We should be able to connect to others, maybe family members. If we are unable to contact them physically, we can contact them on telephone, on videos, WhatsApp-like videos, or we can chat with our friends. We can use the instruments, the gadgets for contacting with others. And then I think we have to stay physically very well. I think unless we are physically fit, I think our emotional well-being will not be there. And to do that, we have to do certain things. Say for example, we should be doing regular exercises, we can take yoga, and we stay positive, most important. And we can do some other things like developing some hobbies. And here I would like to stress one point that what is adding to the stress in COVID-19 pandemic is the overuse of social media. I think they're taking over our brains and they're taking over our souls, and that is adding to our stress. So I just suggest, and this has been suggested world over, that we take time off social media. We don't overdo internet. We do only where it is necessary. And this is going to take a calculated, I think, measure to mitigate the stress. So these are some of the things I think which we can do to mitigate our suffering, our tensions, our stresses during COVID-19.
So there's one more question. We've called all the doctors, all the healthcare professionals, the frontline warriors for COVID-19. Besides the common public, how is this COVID-19 affecting the mental health of all our frontline warriors?
Yeah, I think this is very close to my heart, this question, because I conducted a research in my own department regarding the mental health, the level of stress, ability to cope up with the stress, resilience in mental health workers, doctors, nurses, ward boys, and I compared these traits or these things vis-a-vis the patients who were admitted in COVID wards. And to my surprise, I found that some of the things like anxiety and depression, they were more prevalent and they were more severe in the frontline health workers than the patient themselves. Perhaps the patient becoming ill and being ill and recovering, they probably have already coped up with and they have come to terms with the illness. But the doctors who are treating them, they've still not come to terms with that they may get infected or they may become severely ill. So it's important that we pay heed to our frontline health workers. We give them adequate leaves. We insist them to take care of themselves, good care of themselves, both physically and emotionally. and I think we compensate them adequately by way of giving them remunerations or by giving them incentives in different fields. It's not only just talking about them, but doing something concrete about them will lead to a moral booster for these frontline healthcare workers. And I'm for one, I think for frontline healthcare workers, they're doing their duties day in, day out without caring for themselves. There cannot be any instance in history where I think doctors have done more than what they've done right now in pandemics, other than the wars. And I think I all stand for them, and my sympathy, my empathy, and my good wishes go for them.
Thank you, sir. That was indeed a beautiful answer. Thanks is not enough for all the healthcare workers, for all the frontline warriors, but definitely a moral boost can make a lot of difference. So there's one thing which I was wondering, that the patients who were already suffering from some mental illness, from some depression or anxiety disorders, have those illnesses exacerbated in this pandemic, or is there a relapse? And secondly, are there any new cases of depression or anxiety which you have probably experienced during your OPD, or the patients turning up to you during this pandemic?
Brilliant question. Yes, because COVID has created stress in everybody, and it has created more stress in our patients who are already suffering from anxiety, depression, or whose anxiety, depression was under control with medications, or who had given up medications and who were keeping normal, who were in remittance. Unfortunately, the stress of COVID has led to relapses of psychiatric illnesses, and patients have already who have been receiving treatment, their symptoms have got exacerbated because of COVID stress. That is true. And definitely there is an increase of anxiety and depression during COVID times. I can say from my own OPD at SJT Medical College and Hospital and my own practice that patients have increased many times over, especially of depression and anxiety. And the reasons are, I think, easily understandable. I think anybody can understand what are the reasons. People are uncertain about, people are lonely, and people have lost jobs, and still we do not know how things are going to unfold. And added to this, people have not been trained to cope up with the stress. They do not know how to cope up with this. So my purpose of coming to this particular talk was one, that I can at least tell some things to people they can adopt at home to reduce their stress.
Sir, unfortunately, a lot of suicides have happened during this pandemic. What do you say about that?
Yeah, I think this is one unfortunate aspect of pandemic COVID-19. One reason of increasing suicide is that psychiatric patients who are already suffering from psychiatric illnesses, they were not taken care of initially, and many of them were suicidal, so they might have committed suicide because of lack of care, both from the health services as well as from the caregivers. Maybe the caregivers were placed at some other place and these patients were placed at some other place. But I believe suicides have increased because of one, the stress of the COVID itself. Two, probably the COVID virus itself is doing something to the neurons, which is making people to think of committing suicides. We do not have enough data to prove that, but some neurological symptoms are caused by COVID-19. So it is possible that some of the suicide case may be direct offshoot or direct outcome of the COVID infection itself. But one thing we must understand, that suicide is a very complex phenomena. There are a variety of reasons because of which people commit suicide. We cannot simply say that he committed or she committed suicide just because of one reasons. But a common consensus which we have about suicide is that there should be at least two conditions present in a person for someone to commit suicide. The first condition is that one must be suffering from a psychiatric disease. It may not be diagnosable, but because many patients, they do not go to a doctor for psychiatric illnesses because of shame, taboo, or stigma. But psychiatric illness is a must, is a necessary condition for someone to commit suicide. It is not a sufficient condition for someone to commit suicide, but it is a necessary condition. Then there have to be, other factors like psychosocial stressor in different forms. They may be related to the relationship problem, they may be related to the finances, they may be related to some other issues pertaining to that individual. So when these two factors confluence, the situations become ripe for someone to commit suicides. So it's important in this pandemic era that we must increase our resources to identify at an early age, early stage, people who are at risk for committing suicides, understanding suicidal risks, who are the one who can commit suicide, identifying certain groups, say for example, lonely, elderly people, school-aged children, people who are using substances. So these are some of the groups which are at increased risk to commit suicide. So we should be targeting these, and we should be engaging them, say, probably in one-to-one conversation, which will mitigate the chances of their committing suicide.
So there's one more question. As you just said, that people, probably because of a taboo or because of a hesitation, they do not go to a psychiatrist. But then for a patient himself or for the family members, what are the indications that the person must be taken to a psychiatrist?
Yes. I think this question should have come at the beginning, but I'm glad that you asked the questions at the end of the session. Because unless we know, what we're looking for a person to be taken to a psychiatrist. So I will enumerate some of the things which, if we detect in our near and dear, we must take that person to a psychiatrist or a psychologist. It's important that it doesn't really matter if somebody doesn't go to a psychiatrist. Ultimately, that person will die because of suicide. So that family will suffer. Nobody else is going to suffer. So we must understand that going to a psychiatrist is nothing. It's just sorting out problems and getting on with life. It's no more than that. There's nothing else in that. In this particular situations. So I will enumerate some of the symptoms and signs. If you see in your near and dear, it's a time that without shame and taboo, you take that person to a professional. You seek professional help that will save life of that individual, that will make him functional, and that will contribute to, I think, useful living, for that person who is part of the society. So some of the symptoms are like, say for example, somebody is worrying excessively, somebody is not eating properly, somebody has lost weight, somebody is not communicating properly, somebody is irritable, angry unnecessarily, somebody says that he cannot get rid of thoughts in his brain, or somebody who is hearing voices, somebody suspecting other people harming him, somebody who just lethargic and not coming out home. Somebody complains of persistent fatigue and pains and aches inside the body. So these are some of the things I think we should be looking in our near and dear. If we find these lasting for some days, I think it is time that we should consult a professional. I think consulting a professional is the single most important factor in, I think, recognizing psychiatric illness and treating them. Unless they go to a professional, it's not possible to get these people well. I think it is very understandable. And I can assure you one thing, that I cannot do anything about how society or what society thinks about psychiatric illnesses, or what do they depict psychiatric illness in what forms. But I can assure you, if somebody comes to me or one of my colleagues in Department of Psychiatry, we certainly can change the attitude of that individuals, and we can make him recover and function normally like any other individuals. It may be surprising to you and surprising to you all that many of the psychiatric illnesses, they recover completely, even more completely than many of the medical ailments. And many psychiatric patients, they remain well, absolutely well throughout their lives. And many others, they recover, if not completely, they recover to a large extent, and they can function very usefully and optimally in our society.
Definitely. Sir, so what is the take-home message which you would like to give for our audience?
Yes, my take-home message is that one should take care of oneself comprehensively, good care, and one should stay physically well, physically fit, and emotionally fit as well. If one is fit himself or herself, one can take care of other loved ones in the family. So this is all I want to say. And one thing before we end up this conversation, that please take help of a professional if you can't sort out your problem.
So that was a wonderful discussion, and we had beautiful insights on mental health and state during COVID-19 by Dr. Mehla. I hope the entire session was very useful for our audience as well. And now we know when to seek a professional help. So thank you so much for joining.
Yeah, thank you. And I wish, I'm given another chance to come to this stage and talk again about some other issues of mental health.
Yeah, definitely, sir. It would be a pleasure for all our audience as well. Thank you so much for joining us.